Julie Tristan, and I'm so excited to talk to my guest today because he is my actual doctor, Dr. Horwitz from For Life. He helped me with my foot pain, and I just love you so much. Thanks for being here today.
My pleasure.
So Dr. Michael Horwitz from For Life, you and your doctors, I know you guys have so many tools in the toolbox. You help people with their feet problems or any foot issue that you have, you can help them. That's why I decided to come to you. You helped me with my pinched nerve. Then I had plantar fasciitis in my other foot, and now zero foot pain is what I have, and it feels so good.
Awesome.
So first of all, thank you so much for what you do.
Well, that's awesome. That's why we do it. It's so much fun. And the diversity in Missouri is so cool. We get so many different people. It's great.
So tell me about this removable bone screw that you use in bunion and other foot surgeries. So the metal gets to come out after a few months?
Yeah, conventional foot surgery requires some kind of fixation. Sometimes you see people walking around with K-wires. A lot of times they have permanent screws to fixate the osteotomies or the cuts in the bone that are made to fix, say, bunion deformity. Well, as I sort of progressed through my career, I sort of saw quite a few patients that complained of hardware pain. In other words, they had a bunionectomy years ago and they did fine post-op, but then as the weather changed or they developed possibly some arthritis, they started to feel that metal, or at least they claim to have felt the metal in their body. And I believe that this is absolutely true. And it's been proven in textbooks now that metal contracts and expands. And this is secondary to temperature change or changes in barometric pressure. So you probably have somebody older or possibly younger that feels these changes. Well, we wanted to dispense with that. So we started using a screw called the Safety Fix Easy Out Bone Screw. This screw is removed from the body very atraumatically. At the 3-month mark, the screw comes out in a procedure that literally takes no more than about 30 seconds through a 3mm incision, 1 stitch, and we oftentimes let patients run the very next day. So the opportunity cost is super low, and now these people are pain-free. Patients of mine now can literally boast that they don't have hardware in their feet. They don't have to worry about these problems. And this is good for lots of different procedures that are performed by podiatrists and orthopedic surgeons.
Pretty amazing. And I know you also have had a lot of success with a tiny implant to correct painful flat feet. Tell me how that works and why you're such a fan.
Back in the day, when I was a resident, my director had invented the original flat foot, minimally invasive flat foot procedures. And it was still a peg that was cemented into a hole that was actually right where a bone is that overpronates or causes flat feet. Well, the implants have now evolved to the point where it's a 5-minute procedure. You can do them on kids as young as 6 years of age. It literally changes lives. For instance, I treated a young man out of Ladue High School, my alma mater, and he became an all-state running back and went onto a college scholarship. And this story is not rare. In other words, kids that couldn't go out to recess and play without pain are now above the rim. Basketball players, all-state football players, and this happens because of these stents. They're very, very easy to apply. And what's great about them is they're life-changing. They literally allow you to be less apropulsive and conduct your activities in a much more efficient way and prevent other problems like bunion deformity and hammer toes that often come with flat feet.
And I understand that you have entire families that come in for foot correction, and they've had some great results. So tell me about them.
That's right. I mean, well, of course, because flat foot is a congenital problem, it runs in families. And so, of course, there's going to be families that have flat feet. It usually starts with mom or dad or one kid. Sometimes it's the oldest kid. But we treat families that we're currently treating a family that's got 5 kids, all with flat feet, started with mom. And it's not rare. And it's great because after you get through the first couple of procedures, or kids, if you will, the pressure's off. All the other kids fall in. They know it's not a big deal. It's not a painful procedure. They're usually done at Mid-County Surgery Center, my surgery center, or we do them at Missouri Baptist. And it's just absolutely one of my most fun things to do as a doctor because you get to change lives with just a 5-minute procedure.
It's pretty amazing stuff. So if you've lost your quality of life because you have this foot pain, it is time to get your life back. Do all the activities that you've been missing. Dr. Horwitz and his team, they have cutting edge solutions to your foot problems. And if you're out of state, Feet for Life offers virtual appointments, kind of like our virtual interview right now. They'll help start the process of getting you pain-free. I, for one, know he does an awesome job. I have no more foot pain. So thanks so much, Dr. Horwitz, for helping my feet and for everything that you do for everybody to make them not have that foot pain that's so annoying sometimes.
Thank you so much.